I am Jennifer McKee, and I am here with Dr. Emily Parke. I am a certified integrative nutrition health coach and ACE certified health coach as well. And Dr. Parke is a functional medicine doctor, amongst other things. I believe she has a lot more certifications than just that, but she'll be telling you about that in just a few minutes. So for those of you who don't know, I've lost 185 pounds naturally, kept it off for over 2 years now, and my journey inspired me to become a health coach to pay it forward, to help other people create healthy habits, and to teach them that they can also make major changes in their life without feeling overwhelmed, and just working on the mindset, because our mindset holds us back so much with getting to where we want to get to. So I wanted to do this interview today regarding Hashimoto's and hypothyroidism rather, because I actually have Hashimoto's and I have hypothyroidism. So my story with that is I was diagnosed with hypothyroidism in 2006, and I was told to take Synthroid, or the generic version of Synthroid, for the rest of my life, and that was really my only option. And that I was told that by a traditional medicine doctor. And then I started doing some research just a couple of years ago, realizing that finding out that most people with hypothyroidism actually have Hashimoto's. And so then I went to see Dr. Parke. She tested me. I had Hashimoto's, big surprise. And then so we were trying to get to the root cause of Hashimoto's at that point, because hypothyroidism is just a symptom of Hashimoto's, which we'll talk about. But I wanted to do this interview just to kind of educate people, because there's so many people out there that have hypothyroidism who are just kind of blindly taking Synthroid, not really investigating maybe some other issues that might be happening underneath the scenes. So I want to hand it over to Dr. Emily Parke, and I want her to, first of all, give us a little bit of background about you, and then also to tell everybody what functional medicine is.
Sure. Yeah. Thanks, Jen. I'll start with functional medicine. Functional medicine is all about finding and treating the root causes of whatever signs and symptoms are going on. It's the deep detective work of getting to the bottom of the multiple reasons why you're experiencing the symptoms you have today, or the diagnosis that you have, the disease that you have. And it's different than traditional medicine because in traditional medicine, they teach us, and I am completely traditionally trained. I went to medical school, regular medical school, internship, residency, fellowship, all on the traditional side of medicine. So my training and background is there first. Then I got trained and certified in functional medicine. So I can kind of speak, very freely to both sides of it. And of course, my heart, goes naturally towards natural medicine and functional medicine, right? So in traditional medicine, they teach us, you have this symptom, here is this filler procedure. There's not a whole lot of thought process as to why, or, how to work on it with lifestyle factors like nutrition, sleep, exercise and movement, stress management, toxin reduction. Those 5 I like to call the foundations to health, because if they're not in a good place, we can't expect your health to be in a good place. So, and that is really about 80% of most health issues. The other 20%, I like to say, is what's going on in your biochemistry. And that's where, the advanced functional medicine testing that we do, that again, they don't teach us in traditional medical school, comes in really nicely. And even regular traditional blood work tests, we also look at them through a different lens. We don't just say, everything's normal, good luck, because there's so many people that have normal labs that don't feel normal. And so we look at normal versus optimal, where you are, how it's affecting your health, and what we're going to do about it moving forward. So that's the quick version of, functional medicine. And as I mentioned, traditionally trained first, and then, trained and certified in functional medicine. And I now do 100%, functional medicine at a practice here in Arizona.
I love that you have both backgrounds, because that's why I love talking. One of the many reasons I love talking to you, because you have just such a great perspective on everything. So it's really great. So that's great. So now I want to ask you, what is hypothyroidism?
Okay, so the term hypothyroidism, if you break it down, the first part of the word hypo means low, and thyroid is thyroid. The thyroid gland is this kind of, butterfly-shaped gland that sits, right about here in your neck, and produces thyroid hormones. So hypothyroidism means a low-functioning thyroid. Now, this can get a little bit confusing when you're looking at labs, right? Because when a traditional doctor orders a thyroid test, they're likely only going to order a TSH. So TSH stands for thyroid stimulating hormone. It's really the signal of what the brain is telling the thyroid to do. What the thyroid's actually doing, as far as hormones, we're talking about now T3 and T4. And so the TSH only gives you part of the picture. But as I was mentioning, it can be a little confusing because a high TSH, so a high thyroid stimulating hormone, actually means you have a low functioning thyroid. So if you take a second to think about it, why that is because the brain is telling this thyroid that's not functioning very well, hey, give me better function, pump out more thyroid hormone. So that's why the signal, the TSH, is elevated high in hypothyroidism. So it's an opposite phenomenon. But the actual thyroid hormones themselves are, true, as in hypo or low functioning thyroid, they will be low. And in high functioning thyroid, they will be high, just to kind of clarify that.
Yeah, that's kind of confusing. And I know too, like just talking about, and you kind of alluded to this, like on the blood test, like if you look at your blood test yourself, it'll show you like the range that is normal. And I know with TSH, I don't know about the other thyroid levels, but I know with TSH, what they say is not exactly accurate. It's not optimal, I should say, right? Like the range is not
Right.
optimal.
Yes.
They say as normal on the blood test. Is it like, I forget what it says. Does it say like 1 to 4 or 0 to 4 or something for TSH?
Yeah, it's like, exactly. So super close. So for most labs, it's something like, 0.3 to 4.5. So it's this huge range of, normal. But a healthy functioning thyroid should really be somewhere between about 0.5 and 2 to 2.5 is kind of the, highest limit of a healthy functioning TSH. So healthy functioning, indication of a good functioning thyroid. But the free T3 and free T4, so free means the unbound thyroid hormone. So that's what's biologically active, and your cells really care about free T3. Free T3 is the most biologically active form of thyroid hormone. And there's an optimal ratio between T4 and T3, and your body is, is going to convert T4 into T3. And sometimes there's a slowing of that conversion, which can lead to, lower than optimal free T3, which means then your cells are still kind of, starving for T3 at the cellular level. Now your thyroid, something to mention, why I say cellular level is because the thyroid controls, your entire metabolism of your body. There's a receptor for T3 in every single cell of the body, so it is extremely important. So ideally, you want your T3 to be approximately about 3 times your free T4. So free T4, free T3, you want free T3 to be about 3 times or so your free T4. If it's not close to that, then you likely have a conversion issue, which there's many different reasons why you might not be, converting properly.
Yeah, that's really interesting. And I know that, and I know you've heard this a lot more probably than me, but I've heard this from people too, where, their TSH is like 4 or something like that. And they're saying, but I don't feel normal. I don't feel normal, but their traditional medicine doctor is saying, well, you're in strange. It's normal. Like, so just get more sleep or just drink more water, whatever. But they know that there's something wrong. And I know when I had, like when my thyroid numbers were out of whack, I knew something was wrong. Like I was fatigued. I wanted to take 3-hour naps in the middle of the day. And I was getting enough sleep at night, and I was eating healthy. I was drinking water. So I knew that there was something else going on there. So, but I'm wondering, like, have you ever had a patient where their TSH was, I guess it's all the numbers, not just TSH, but like where it was in between the optimal, and then they're like, I'm not feeling well, even though it's in between like 0.5 and 2.5.
Of course.
Yeah.
Of course. I get a lot of them actually, right? In the office. They're the patients that went to a traditional doctor and, they were told everything's normal and they didn't get, the help that they were looking for. So so a full thyroid panel is, if you're doing the big thyroid panel, it would be a TSH, a total T4, a total T3, a free T3, a free T4, and a reverse T3. The pared down, most common version that we do in functional medicine is a TSH, free T3, free T4. Why? Because the free T3 and free T4 are what are most, biologically active. And the reverse T3 is important too, because it looks like regular T3, so it's structurally similar, but it can actually bind to the cells where regular T3 would normally bind. And so what that means is then your cells are still kind of starving for T3 because the reverse T3 has bound it up. Now there's, I want to definitely make sure we mention that there's all kinds of reasons why, you either might not be converting properly T4 to T3 and, having, higher reverse T3. And there's some really common ones, like for example, inflammation. So we know inflammation, we know stresses, we know nutrient deficiencies. So for example, vitamin D, vitamin A, magnesium, zinc, selenium are really common nutrients that are, deficient or less than optimal when there's a thyroid conversion problem. And, then there's chronic infections and toxins. There's a big list of things we look at in functional medicine when you don't have an optimally functioning thyroid, because at the end of the day, we want to know what all those root causes are so that we actually repair and fix the problem, so that you don't continue to have issues.
Yeah, and often I think, you know better than me, but I think there's probably maybe more than one root cause, that could be going on, right?
Absolutely. And for most people, it is more than one root cause. For most people, it's, multiple things that, add up to how you got where you are today.
And, one other thing I guess I think that would be beneficial to talk about is what are some of the symptoms of hypothyroidism? So I just mentioned one, which was fatigue. But I thought maybe you could mention some other common symptoms.
Sure. So there's common symptoms, and there's typical symptoms that you would think of, but not, just a reminder, not everyone fits in that little perfect box, the symptoms I'm about to describe, and it is different for everybody. So when there's hypothyroidism, everyone thinks of an overweight or obese person tend to have a more round face. The outer third of the eyebrows can be thinned. The hair can be thinned. You mentioned fatigue, right? So that's a huge one. Energy levels. Cold, especially cold, hands and feet. But there can also be, mood disorders. There can be, depression. There can be anxiety. There, about 20% of patients also have, musculoskeletal symptoms. So like muscle aches and joint pains. So the symptoms are very diverse, and each of the symptoms I just mentioned, there's multiple different causes of each, not just hypothyroidism. So you can't say, oh, fatigue, I definitely have hypothyroid. No, like the list of things that could be going on is huge. Or, oh, my hair is thinning. What is it? Oh my gosh, like there's so many things that could be contributing to that. So that's the stereotypical quote hypothyroid patient. Now I can tell you, I have plenty of really thin hypothyroid patients, and I have hypothyroid patients that have beautiful sets of hair, and I have the stereotypes aren't the typical common things we learn in medical school, like not everybody fits into that nice little picture.
Yeah, because sometimes I know, like when I first got diagnosed in 2006, I don't remember what my TSH was, but I don't think it was that high. I think it might have been like a 4 or 5 or something. It must have been at more than 4.5 if they put me on medication. But the point is, I was trying to lose weight at the time, and they told me, well, you might as well not even bother, because there's no way you're going to be able to lose weight with a high TSH. And I just was so discouraged and just thought, like, is this true? And I actually was able to lose weight. And I know, like, on my weight loss journey now, where I lost 185 pounds, during that time I was seeing a traditional medicine doctor to keep tabs on, my TSH level. And during that whole time, it was anywhere between a 4 and a 7. And I still lost 185 pounds. So I think it might just depend on the person's body. So I would say if your doctor or traditional medicine doctor has told you can't lose weight if you have hypothyroidism or a high TSH, to still try to make those healthy changes and see, what happens with your body.
Yeah, absolutely. There is so much more to the picture, for sure. It's not simple at all.
Yeah, so don't use it. I'm saying don't use it as an excuse to keep eating junk, basically.
No. Yes, absolutely. Absolutely. Because, if your thyroid's not functioning perfectly, we know that it will slow down your metabolism, but it doesn't, like, as you just mentioned, it doesn't make things completely impossible.
Right, right. And also creating healthy habits, even if you're not losing maybe as much weight as you want, or even if you're maintaining, it's still good to have those healthy habits and to drink water and to eat healthy anyway. So you'll be a step ahead of the game, once you get your
Yes.
thyroid, where it needs to be. So, um, okay. So, the other thing I want to talk about is Hashimoto's. So Hashimoto's is an autoimmune disease, and I'm going to let you take over, and can you describe, like, I
Sure.
love how you describe things. So, like, could you describe what Hashimoto's is? And I'm
Yeah,
going to
sure.
talk to you about how hypothyroidism is linked to Hashimoto.
Sure. Yeah. So, as you mentioned, Hashimoto's thyroiditis is an autoimmune disease. And so the term autoimmune, auto, self, immune system. So your own body's immune system is basically creating antibodies. So antibodies are part of the immune system that are attacking your own thyroid gland. So your body is attacking your own thyroid gland. So what happens is over time, the thyroid gland gets destroyed. And that is how it leads to hypothyroidism, because when the antibodies are attacking the thyroid, it's basically kind of eating it. So the gland over time becomes, smaller and smaller and less functional.
Okay, great. And I was just thinking when you're saying that, one thing I was going to say earlier, which kind of relates a little to this, but so when I first went to see Dr. Park, I think my TSH was at like 9. I don't remember what my other numbers were, but now my TSH, the last time I had it tested, which was a few months ago, maybe like 4 months ago, it was at like 1 or somewhere around there. And
Yeah.
never in my life, and since I was diagnosed with this in 2006, have I ever had a TSH that low. And I can tell you that I feel great. Like, I feel so different. It's like night and day, like, to how I felt. And so I'm just saying this because I don't want people to give up hope, because it did take us a while to figure out what dosage I needed to be on and all this stuff to kind of get my thyroid where it needed to be. But it was really worth it, because in the grand scheme of things, it didn't take that long. But, to figure out what my body needed, and we did. So I want to thank Dr. Park for that, because she's the
So,
only doctor who has ever gotten my thyroid levels where they need to be. So, like, thank you so much for that.
oh, you're so welcome. And you nailed it. Now so thyroid hormones are exactly that. They're hormones. And, part of the challenge with treating hypothyroidism is it's a guess where you start with dosing. So you look at a TSH and a free T3 and a free T4 and you go, okay, like, wow, it's, your TSH is really high and your free T4 and free T3 are low. Like, maybe we'll start with this dose. But it's because your body is this, giant biochemistry experiment. That's exactly what you have to do. You have to start. And then in about 4 to 6 weeks, we recheck blood work and we find, and then we use blood work as a guide along with your symptoms. How are you feeling? To guide what we do next with dosing. And for most patients, it does take a few adjustments. I would say 2 to 3 on average. You maybe had a little more than that.
Yeah.
Come on.
Yeah, I'm always the weird patient that it takes a little bit more time for, but I mean,
Yeah.
honestly, in the grand scheme of things, it didn't take that long. I mean, I don't remember now. Maybe it might have taken 6 months, maybe. I don't even think it took that long though. I think
Yeah. And
somewhere around there, 5 or 6 months.
yeah, like, you were definitely more of an outlier as far as like how long it typically takes, but it definitely takes, I would say on average 2 or 3 kind of dose adjustments and comparing symptoms before we really get it right. And then, my goodness, there's so many variations of thyroid medication. And then, there's compounded thyroid hormones. So there's multiple different ways to skin the cat. So you mentioned this at the beginning, like, your doctor put you on Synthroid. So Synthroid is levothyroxine, which is really a T4 analog. And so that's, that's only T4. But as I mentioned, a bunch of times now, part of your thyroid hormones is T4 and T3. So there's medications like Synthroid that are T4 only. There's medications like something called Cytomel, which is T3 only, triiodothyronine, and or leothyronine. And then there's the natural desiccated thyroid hormones, which things like Nature Throid, WP, NP thyroid armor, that naturally contain some T3 and T4 in it both. And I've found historically that patients tend to respond better to the combination of T4 and T3, so the natural desiccated thyroid hormones. But if the beauty of it is because you can compound whatever dose you wanted. And I do have some patients, right, that, you can't, you're not getting optimal thyroid function with the exact, prescription that you can write. So then you can compound it. So you can say, hey, pharmacist, I want X amount of T4 and X amount of T3, and you can make it happen.
Yeah, I'm glad, because that's one of my questions too. It was for you to talk about the different treatment options of hypothyroidism. And so usually traditional medicine doctors will give Synthroid or levothyroxine. Am I saying that right?
Yes.
And like you said, that's just T4. And I was on that, beginning in 2006. And every few years I would start to feel fatigue. I'd have to go back to the doctor. They'd say, we have to increase your dosage. So that went on for the whole time I saw you, like up until I saw you in 17. So for like 11 years, every few years I had to keep increasing my Synthroid dosage because it wasn't enough. It wasn't working. And so anyway, what I ended up doing with you was doing the T3 and T4, which I think made a huge difference. And one thing I think that we can maybe mention was that, with T3, you can't always absorb all of it at one time. And so like I have to take it twice a day so that my body can absorb it. And that was, once I started doing that, I just saw like so many improvements with how I felt, but also just in the labs too. So maybe you can talk a little bit about that, about the T3 absorption.
Yeah. So, and just in general, so T4 has a very long half-life. It's about a week long, so it hangs around a long time. T3 is more like hours. And so that is why sometimes we have to dose T3 once in the morning and then once in the afternoon. And also why sometimes if we do compound it, we can actually kind of make a sustained release of T3 so that there's more T3 floating around. That's not, super common, but, you've experienced it. And I've had plenty of other patients that, we have to get creative with the thyroid dosing in order to get, you feeling better and to get, the optimal thyroid function on labs that we're looking for.
Yeah, this is the thing. Like we said, like everyone's body is different. It's sort of a trial and error kind of thing to see what's going to work for somebody. So yeah, totally. So let's talk now about the root causes of Hashimoto's. Like, I think this is interesting because there's so many different root causes of it. And the other thing too is I think Hashimoto's seems to be pretty similar. Common. I know so many people that have Hashimoto's that I was quite surprised at how common it is. So I don't know if you can speak to that, but also, what the root causes are as well.
Sure. Yeah. So no, Hashimoto's thyroiditis is, one of the most common autoimmune diseases, and autoimmune diseases on a whole are 100% on the rise. So we're seeing more and more of it. And so, talk about the root causes of not just for Hashimoto's, but the root causes for any autoimmune disease, the things I'm about to say apply to all of them.
Okay.
So Hashimoto's thyroiditis, it would apply to, lupus, it would apply to Crohn's disease, ulcerative colitis, multiple sclerosis.
Rheumatoid arthritis.
Arthritis, yeah, exactly. So it would apply mixed connective tissue disorder. It applies to Sjogren's syndrome. It applies to all of, there's so many autoimmune diseases, I could keep going, but it really applies to all of them because and that's the foundation of functional medicine, is finding and treating those root causes. So those triggers. So when in regards to autoimmune disease, when you have one, what is you have a genetic predisposition, and then but not everybody with the genetic predisposition gets the disease, right? So celiac disease is a perfect example. There are some countries that have, about 30% of the population has a celiac gene, but only 1% of the population actually has celiac disease. So
Wow.
what's the difference, right? Why? And not every autoimmune disease has a gene, like, celiac disease has a gene, right? But it does tend to run, autoimmune diseases certainly tend to run in families. And no, there is not one Hashimoto's gene that we know of yet.
I was wondering.
Yeah. So there's the genetic predisposition, and then there's the triggers that kind of flip on the autoimmune disease. And as we mentioned earlier, it's usually multiple things that happen over time. Now, you can have someone that had a significant traumatic event, toxic exposure, something that happened one time that, you know, triggers it, but it's way more common to have things start early on in life, and they just kind of add up, and eventually you get that last straw that breaks the camel's back, and here it is. So it is really important to figure out what those triggering events are, what those triggering causes are, because if you don't, your disease is still going to be moving forward, even if you take medication. Even if you start feeling a little bit better, you're not going to all the way get there until you figure out what all those root causes are and start working on them. So I think you asked me, like, what are, you know, common root causes? So of course the gut, right? 80% of the immune system is located inside the gut. So what is going on there? Do you have enough beneficial bacteria? You want to make sure, of course, you have enough good guys, right? Do you have an overgrown, you know, pathogen? Do you have, you know, an actual parasite, or do you have you know, bacteria that is not found in those levels inside the gut? So not even necessarily a true acute infection, but even a chronic infection. You know, so do you have an overgrowth of bacteria going on in the small intestine? You know, do you have a yeast overgrowth? Do you have, you know, we could go on and on. Do you have food sensitivities? Like, so the gut, food sensitivities is very common as well. And I always, as part of the autoimmune disease, you know, process, I always, in treatment, I always send people through an elimination and reintroduction process to help figure out what food sensitivities are. But so that's gut. Gut is really common. But then there's the HPA axis, or the adrenals, and stress is one of the biggest triggers that is out there. And I have seen stress by itself, with nothing else going on in someone's life that's changed, trigger autoimmune disease. And then, yeah, exactly. So that's huge. And stress is stress of all kinds, by the way. So not just, you know, mental, emotional stresses like we think of, but, you know, the term stress really applies to your entire body, what's called your total allostatic load. So the total amount of stress is coming in from all places: mental, emotional stresses, physical stresses, you know, chronic infection stresses, inflammation. You know, it all kind of adds up to one giant load on the body.
Yeah.
Yeah.
Yeah. And the other thing too that I found kind of interesting, and I don't, well, there's two things I think of. One is that I've heard that a majority of people with Hashimoto's have a gluten sensitivity or intolerance. So I think people with celiac disease, do they have, a lot of them have Hashimoto's, or I think I read something about that. I'm not sure.
Yes. Okay. So, it's very common when you have one autoimmune disease to have 2 or 3 sets of antibodies. So it's not uncommon to have patients that, you know, that have more than one autoimmune disease going on. So number one. Number two, yes, you are correct on gluten. You know, gluten is probably, you know, the top trigger as a food sensitivity for autoimmune diseases of all kinds. But in Hashimoto's, you know, there's actually a theory that gluten, because gluten looks kind of structurally similar to the thyroid. So the theory is that there's this process called molecular mimicry, where when you eat gluten, your immune system in your gut sees it, because it leaks through the intestinal lining, which, you know, the lay term is leaky gut. The medical term is intestinal permeability. So when you eat gluten, what happens is it creates a little bit of inflammation for everybody, whether you're gluten intolerant or not. But if you have a really healthy immune system and everything's going great, and you have all the nutrients to repair it, and then what will happen is the tears will, you know, heal up pretty quickly. But if your immune system's awry, if you've got stresses, toxins, chronic infections, nutrient deficiencies, etc., those little tears don't quite heal up. And then what happens is food starts to go, you know, get from the lumen of the small intestine, where it's supposed to be. Like, it's supposed to be a closed circuit from here to here. So when you get, you know, this intestinal permeability going on, then all of a sudden your immune system, and again, 80% of your immune system is located in the gut, very rich in lymph nodes and lymphatics. And your immune system sees that and it goes, what is that in the blood? I don't usually see that. So what does your immune system naturally do when it sees a foreign invader? it creates antibodies because it's like, I got to get this thing, right? Like, why is it in the bloodstream? So when those antibodies come out and about, that's when gluten. That's when for Hashimoto's patients, that's when you can get basically like a Hashimoto's kind of crisis, or an increased uptick in the antibodies, because it looks structurally similar to the thyroid. So then your body, you will go, oh, okay, there's more. Like the thyroid looks just like that, and so the antibodies will rise.
That's really interesting. And the other thing I was going to say about gluten is I had originally done an elimination diet for a lot of things, but gluten included. And I cut gluten out for about, I think, 8 weeks, and I reintroduced that in. And I could not tell any kind of issue with my body. But when I cut gluten out for 6 months and then had gluten again, I thought like someone had drugged me. I felt like I had like bloating, but I had fatigue more than anything, which I thought was interesting because I don't know if that's common or not, but every time that I'll have gluten, if I go a long time without it and then have it, I feel like someone has seriously drugged me, fatigued. I feel like I need to take maybe a 4-hour nap, not a 3-hour, but a 4-hour nap.
Yeah.
And so it was interesting that after cutting it out for 8 weeks, I couldn't tell that. But I know with gluten, sometimes it takes longer to get out of your system completely.
Yes. So on average, if you guys listening out there, if you're thinking, oh, do I have a food sensitivity or not, whether it's gluten or anything, the minimum amount of time to take it out is 30 days. Notice I said minimum. Now you just described 2 months and you didn't really notice a difference. You had to do it for 6 months. Now there are people just like you, Jen, that are exquisitely sensitive to it. And so it takes your body's immune system longer to basically calm down from it. And so that's you. Most people within 30 days to 60 days, certainly 90 days, most people, can tell, because your antibodies, your immune system response comes down enough to where when you do reintroduce it, it becomes like, obvious.
Right.
But if you try to reintroduce it before your immune system has calmed down, you have to have at least a 50% reduction usually, in the antibodies, in order for you to tell if there's a symptom or not. So, but if you happen to be an outlier and slow, to get it out, then, it might take a long time for you to tell.
Yeah, definitely. So I wanted to mention that in case there's anybody else that's a little maybe unusual like me who might have cut it out and been like, well, I don't feel any difference. I would say, well, you might want to consider cutting it out for a longer time and then trying it and trying to reintroduce it just to see, especially I think if you have a thyroid issue or something like that. I don't know if you would agree with me on that or not. But
Absolutely. No, 100%.
okay.
And, and nutrition wise, so definitely, doing a gluten elimination is important, especially as a trial. But, statistically, it's a very, very common food sensitivity and trigger for antibodies and Hashimoto's. But globally, the food plan, like I love, there's certain things that we should all do better at, right? Like, as you mentioned, you want to make sure you're hydrating, you want to make sure you're getting enough plant foods in your diet, right? So that's where the 8 or more servings of plant foods a day comes in. Should be mostly vegetables, maybe 1 to 2 servings of fruit in that whole thing. Less processed and packaged food items, less artificial colors and sweeteners, less sugar. Those are all kind of, global things that everybody out there can do, to help improve their health. But, if you look at other common triggers for autoimmune disease, so there's definitely gluten, but other grains can do it too. Like, for example, corn is a common one, but it can be any grain that can trigger. And so I will have people with Hashimoto's and other autoimmune diseases do an elimination of grains. Dairy is another common one. Legume family is less common, but out there. And soy. Those are common, food triggers for autoimmune disease patients. If I wanted to add another category, it would be egg. The egg is another big sensitivity. So I have people kind of do at least a 30-day, if not a 60-day elimination of at least those items. And sometimes I put people on more of what's called an autoimmune protocol, depending on how severe their situation is when they come to me. and how big of a dietary change it is all at once, right, Jen, talking about habits.
Yeah.
So, and so I use a paleo template to do this. So if going on a regular paleo diet is a big enough change, I'm definitely going to start there, because I'm not going to ask you to do an advanced autoimmune protocol diet, going from eating fast food 3 times a day. Like, that's not,
Right.
if it goes well, it won't go well long term.
Right, exactly.
Yeah. So, slow and steady wins the race a lot of times with these changes. And, if you are going to do a food elimination like Jen did, you want to really commit to it. It's one of those situations where if you happen to be in the small percentage of people that are exquisitely sensitive, if you have that food item again, your immune system goes right back up. And then it's going to take however long to kind of, come back down.
And one thing too, like when I started looking at this stuff and doing the elimination diet and started looking at labels. Now, I don't eat a lot of processed foods, but I do eat some stuff that's packaged. And just looking at that stuff, I could see a lot of it contains soy. I feel like soy is in almost everything.
Yeah.
And so ever since then, I actually don't really eat soy, hardly at all. So, but that's just my own personal choice. But my point in talking about this is just that sometimes soy, gluten, corn, they don't have to tell you if it's in there. You have to actually look at the ingredients to see. But, those things are in so many things that we think that they're not in. Like when I started reading labels, I was shocked that there was gluten in this or soy in that. And it was just kind of shocking. So it does take a commitment when you can't just assume that gluten's not in this veggie burger or, soy is not in this, whatever, you have to really look at the label for doing something like that. So anyway, but thank you so very much for your time. I don't know if you have any additional comments you would like to say, anything I didn't cover, but you've answered all of my questions. But I don't know if you have anything else that you'd like to say.
No, this is great. I mean, I do, I guess the last thing I would say is, I have had patients recover from Hashimoto's thyroiditis. It's possible. Not everybody can we get antibodies down to undetectable or, within, normal ranges. But it is possible. I do have some patients in the practice that we have been able to successfully do that. Now, it takes time. And I'm talking a year or two. Actually, my last Hashimoto's patient, it took 2 years, but she is actually off thyroid medication and has optimal thyroid function and no thyroid antibodies at this time. And so it's possible. It might not be possible for everybody, just to keep that in mind, but you always want to make the healthier lifestyle choices, and you want to get those antibodies down as much as possible, as much as you can. We're always able to reduce the antibodies, but whether we can make them go away completely or not is a little bit variable depending on how long you've had the disease and how severe it is. So I would say don't give up hope. If you feel like you may have a thyroid problem, find a functional medicine provider in your area so that you can get, adequately tested with with more than just a TSH. You want to get the full thyroid panel with thyroid antibodies to find out what's going on.
Yeah, and I would also say if you've been to a traditional medicine, it doesn't have to be a traditional medicine doctor. If you've been to a doctor, period, and they're telling you your levels are normal and they're not really helping you try to get to the root cause when you know that something's going on in your body, I would invite you to see a functional medicine doctor, like you said, in your area. Can you give the web address for where they can do the locator on?
Sure. Yeah. So if you want to find a functional medicine, certified functional medicine practitioner in your area, you go to IFM, which stands for Institute for Functional Medicine.org, and you can search for a practitioner in your area.
And could you let listeners know how they can find you if they're in the Phoenix, Arizona area?
Awesome. Thanks, Jen. Yeah. So you can visit my website, which is azwellmed.com or dremilyparke.com, my name. And I'm located in Paradise Valley, Arizona, it's really close to Old Town Scottsdale. And myself, and I have 3 other practitioners doing functional medicine at my practice. So yeah, we'd be happy to help if you're local.
Great. And if anybody is interested in losing weight or creating healthy habits and, trying to get past self-sabotage or anything like that, you could get a free 30-minute consultation with me. So my web address is mckeehealth.com. So anyway, thank you so very much, Dr. Parke, for being here. I really appreciate it. Thank you so much.
You're welcome.